Welcome, everybody. We'll just give everybody a couple of minutes to just find their places and make sure everything is working. I'll just make sure that I'm all set up on my end and just getting this ready to go. Okay, we've got a few people coming in, so there's quite a few registrants tonight. Guys, I know it has been very short notice. We just decided to put this segment on just a few short hours ago. In fact, there's been a lot of rapid change in the news of late, things being spread on social media. There's a lot of confusion. In fact, we've been receiving a lot of calls and messages from our clients asking questions about COVID-19 and their pets and asking what to do about them being in isolation and how do they manage to get their pet in, all sorts of queries from different angles. And so what I thought, I thought it's good timing for us to really get together and have some questions answered, share some stuff as a group, just make ourselves available really to be able to help the pet parents and the pet owners out there. Not everyone likes being called a pet parent, but I'm going to call you pet parents just to make it easy. I consider myself a pet parent. And I think, with the amount of love and care that we get from our pets and the responsibility that we have towards them, I think, it would warrant the term pet parent. So, look, for the purpose of tonight, that's the term that we'll use. And, okay, I'm just giving people a chance to fill in. It looks like we've probably got quite a full room now. Fantastic, guys. I should just do a sound check. Actually, before I start, can everybody see my screen? I'm sharing a screen saying pet parents, questions answered, COVID-19. Yes, good. Okay, I'm seeing some messages there. Yes, great. And I should ask just about the sound as well. It's hard to ask if you can't hear, but you might be lip reading. Can you hear me? So just the messages there. Yes, loud and clear. Fantastic. Okay, let me have some water. And then we will begin. Again, thank you guys for giving up your time to be here with us tonight. I know you're probably busy and you've got a lot going on with all the craziness that is happening in the world at the moment. And I'm really honored to have you here and to have such a full room. There's lots and lots of people registered there. And, for those who can't make it, we may be able to forward on a recording of this session for them as well. So let's crack on. Okay, so why is this urgent? We only had a few hours notice and we actually put this out and just put it out there to see who would want to join. And ultimately, the response has actually been overwhelmingly high. We were quite surprised, but it makes sense. At the end of the day, there is a lot of misinformation out there. There's a lot of fake news. There's a lot of stuff being shared on social media, and you hear snippets of things here and there. Oh, wasn't there a dog that passed on COVID, and wasn't there this and wasn't there that? And you're like, well, hang on, I didn't hear about that. And then you go and you Google it and you search it, and you're like, is this something new? And you're like, oh no, that's the wrong story that they got. And so ultimately, why it's urgent is that there is a lot of change that's happening right now, and there's a lot of misinformation. And so we're just trying to set the facts straight, give everybody the information that they need. And ultimately, we know that education and awareness is what will save lives. Okay, so if we can get the right information out there, both to yourselves, the pet parents who have attended this session, but also to the others out there who are not here tonight, and you can pass this information on to them, or when you get the recording, you can forward that on to them as well. And ultimately, we want people to benefit from that. So let's roll on. If we don't do the right thing, then pets and people could suffer needlessly. Guys, there have been some really shocking reports, unfortunately, of pets. Thankfully, not in Australia that we've heard of, but I know abroad we've heard of reports of pet abandonment. We've heard of pets being euthanized. Some out of sheer neglect and people just leaving them behind and not knowing what to do, and others with people genuinely being fearful and not knowing whether their pets are a risk to them or not. And out of that fear, unfortunately, doing the wrong thing and having their pets put to sleep or leaving them behind or sort of shunning them and trying to isolate themselves from their pets. So guys, we just want to put all of those myths to bed tonight. Okay, so there are 5 steps that we're going to be talking about tonight. And guys, we are in this together. As I said, I certainly refer to myself as a pet parent, and you know, we deal with pets every day of the week. And as a pet parent, I think it's really hard to see animals suffering. It's really hard to see them being neglected or not receiving the care that they need. And this was a big part of my concern, is that what's happening now is things are sort of shutting down. Things are going to a point where like thankfully we're still open, and at this stage we don't know how it will pan out, but ultimately veterinary services are seen as an essential service. And obviously if veterinary care is not available, there's going to be a lot of suffering in the world. There's going to be a lot of animals who are not getting the care that they need, a lot of people who are going to have to sit there watching their animals suffering and feeling helpless and not being able to help them. And there's a whole lot of besides just the pet care, there's also the whole animal production and food industry, and there's a whole lot of stuff going on there. So the world definitely does need vets to be on the ground right now doing their thing. But I think there's also a need for vets to be online, having some info sessions like this and disseminating this knowledge and clearing up some of the misconceptions and the false information that's out there. So guys, look, we're in this together. Who knows for how long? Who knows where it's all going to go? It's all a little bit scary. I think everybody's had a bit of concern about what's going to happen with their jobs, their income, their businesses, etc. The children, the future, your elderly parents. Like I know I'm in that boat with my elderly parents in isolation, and it's so hard. When you go over and you visit them and they want to come give you a hug, and you're like, oh, please don't. It's almost offensive to say that to elderly parents, but they're challenging times. And so I think we've got to stick together and get through this. So here's the 5 steps we're going to be looking at. What can you do to keep you and your pets safe? Sorry, that's meant to be an S. Measures taken at vet clinics to reduce the spread. So what's actually going on out there? So the first step, guys, we're going to be running through steps that you can do. So there's about 6 different steps that you can do to keep you and your pet safe. Safe, not Dave. And the second thing there that we're going to be talking about is what is actually happening currently in vet clinics, specifically in Australia, but we can talk about other clinics in the world as well and what's going on in that space to try and reduce the spread. 3 is we're going to be looking at alternatives to vet visits and what you can do if you are in isolation. So again, this was one of the messages that we received from someone who was in isolation saying, I'm in isolation, my pet needs medication, what can you do? Can you drop this to me? Somebody else was in isolation from having traveled and their pet needed, their pet was unfortunately in their last stages and needed euthanasia. And, they didn't want their pet to suffer, unnecessarily, obviously. And, that was a difficult one for them, because I suppose as a pet parent as well, you kind of have an idea of how it's going to go and you plan for that and you put all these things in place. And when it does happen, unfortunately, if it happens like this and you can't be there, these things can be tricky. And so guys, look, we just want to work through these things together and find the best outcomes. So for why some pets are suffering during this pandemic, and what are the reasons for that and how can we avoid that happening here? And 5, any other questions, troubling questions that you may have regarding your furry family member and their health. Cool. And guys, look, I know everybody's muted, but feel free to use the chat box if you can't, or if you have a question or something that has come up. And certainly as we go through the slides, I know there's been a lot of crazy information which has come out there, and certainly, I'm not aware of everything that's out there, and things are changing quite rapidly. And so if you know of something that you want to discuss, then throw it up there and let's just talk about that live. That's going to be really important. Okay, cool. So why me? Who is this guy? So for those of you who don't know me, my name is Dr. Shibly. Mustafa, I am a vet. I've been a vet for about 17 years, and I have been in practice in a few different countries, practiced through Southern Africa and the UK and Australia, but I've also worked in a range of different practices, so ranging from referral practice through to emergency medicine and general practice as well. And so I've seen the full spectrum of disease from different angles and in different settings, certainly in the middle of the night as well. And also, you know, I've dealt with a lot of the emotional concerns and pains and grief that owners have had to go through. And look, you know, being a pet parent myself, in fact, we actually, unfortunately, we said goodbye to our elderly cat not too long ago. She was 23 years old and a real sweet little cat. We actually adopted her when she was 12. I didn't think she would be with us for that long, but hey, we must have been doing something right. So ultimately, the main reason why I'm doing this, guys, is that my main focus right now, after all these years of practice, essentially, I focus a lot on education, mentoring and coaching, and working with other practice owners. I own three clinics and work with a team of vets and nurses, and ultimately, really want to provide some information out there and do my thing to help at this time of need. I know that there's a lot of pets and pet parents that can really benefit from this information. And I know that, by sharing this with you, it will also take some pressure off our industry. For those of you who don't know, the veterinary industry has had a few, there has been through a bit of a rough patch. You might have read some of the recent media reports of things like, high rates of depression and suicide. Unfortunately, these things are quite rife in our industry. There's lots of reasons for that. There is a high level of compassion fatigue. And unfortunately, I think the reason for that, the reason for a lot of stress in the veterinary industry is that there's a big divide between the pet parents and the veterinarians, or the veterinary professionals, vets and nurses, and also the expectations, or from both sides, of what they should be getting out of their service. And so we're trying to bridge a bit of that divide there and really work together as a team, because the way I see it, there's three parts to this team. There's the pet parents or the pet owners. There's the pet, obviously, that's the key individual here. And then the third party really is the veterinary professionals and how we're able to help. And if you can imagine like a big Venn diagram, sorry, I don't have one drawn, but if you can imagine that and the sort of overlap there, and really where the three of us need to work together to help each other, because, hey, we're all in this together and we all benefit from that. So again, I'm just a guy who's really passionate about education and helping to move this needle forward and help us through this tricky time and hopefully save a few lives along the way. All right, so let's talk about this activity and exercise. And again, guys, if you have any questions along the way, just give us a shout. So I've thrown in a few just crazy images here, just for a bit of fun. I know things are a bit, doom and gloom at the moment. It's quite depressing, really, if all you do is watch social media, and it's easy to get like stuck in a bit of a rut. So I thought for the purposes of this, we would, for the purposes of today, we would throw in a few images just to get a few smiles and lighten it up a little bit. But look, it is a serious topic, obviously. This image here was of and I don't know how real these images are, so I apologize if anyone is gonna get offended by me using fake images. We're talking about fake news, and I certainly don't want to bring in fake images of things that are not real. But at the end of the day, just take them for what they're worth, a bit of comedic value. So apparently there was this dog who needed to go for a walk, and his owners obviously couldn't take him for a walk, and so connected him up to a drone. Now that looks like a pretty heavy duty drone and quite expensive, I would imagine. So I don't know if I would personally hook a dog up to a drone, but hey, that's all good. So there's some comments there. Someone saying you'd need a bigger drone for your dog. Absolutely. Yeah, probably. Although that one looks pretty beefy. I don't know. I'm sure that could handle even your big doggy. There, John. So look, activity and exercise. This is really important, guys. What we've got to remember is that there have been some restrictions on what we can and can't do. Okay. We can't go and enjoy the things that we would normally enjoy, such as walks in the park, and you know, you can still do that to a certain degree, you know, although people are avoiding that, and I think it's a good idea to avoid that as much as possible. Walks in the park, runs on the beach, you know, doing the usual things that we would do, agility training, etc., etc. All of those fun things that we like to do with our pets. It's all a bit limited at the moment. We're having to isolate ourselves. We're having to isolate our pets. It's quite a closed space, you know, confined sort of backyard or house or whatever it is that they're contained to. And we all know that certain breeds of dogs and cats require, actually cats are quite lazy. I think it's mostly just dogs. Mostly just dogs require a lot of extra energy. They have a lot of extra energy. They require a lot of extra activity because they need to get out and play and run and, you know, fetch and do all sorts of stuff that they're used to doing. Guys, that was part of their routine. They get used to that. They look forward to that. Every time you say, let's go for a walk, you know, how many dogs understand the word walk or walkies or lead or something like that? And as soon as they see it or they hear the cupboard open, they know exactly what's going on. And so what we've got to do is still create that stimulation for them in a confined space. Okay, so things that you can do, play games with them, use laser lights if they're cats. Dogs don't always like laser lights, but cats you can have some fun for quite a bit of time with a cat. You know, use the toy on a string if you've got a cat, or certainly with a dog, you know, certain toys as well can be really, really stimulating for them, and they will play fetch for a long time with those. The other thing that you can do, guys, and this might come in a bit when we talk about diet, but stimulating them with toys and things like that that actually make them have to work a bit more for their food. So you get those. You can even make these at home. You don't have to buy the commercial ones. And certainly, if you're in isolation like now, like I know a few of you are. Yeah, someone's saying, yep, stuck in isolation. So absolutely, if you're stuck in isolation, then you can't really go out and go buying toys and stuff like that. But what you can do is, you know, you can rig up an old milk bottle, you know, cut some holes in it that the kibble could just fit through, and then pour the kibble in the top, shut the lid, and then you've got something there which will stimulate your pet for, I don't know, half an hour, depending on who they are and how motivated they are to get food out of the treat bottle. But ultimately, guys, all of these things are to help stimulate them both mentally and physically, because we do know that you know, when animals are not stimulated, one of the things is they're going to gain weight, and in general they're going to you know, develop health problems when we're not active. We experience that ourselves, but also you know, the mental stimulation. A lot of dogs who don't get out for walks and don't get to burn off that energy, they end up having destructive behaviors. They end up chewing doors or damaging furniture or things like that, scratching at things, which it can be really, really destructive. And obviously, you know, that's going to be hard if you've got to live in a small space for several weeks. You don't want to have all ripped up furniture and chewed out doors. Excuse me. So the moral here is exercise as much as you can, get creative, think outside the box, and do what you can. And for yourselves as well, guys, but I won't go into that. This is all about the pets, not about the humans. Just reading a comment there, someone's telling me about, yeah, absolutely. So Fluffy has, and I'm using Fluffy, that's not Fluffy's real name, but for the purposes of anonymity here, we're going to refer to him as Fluffy. He's chewed, and it's not the first time because I know this dog. He's chewed a hole in the door, and that's not cool. So look, we are actually working with Fluffy for the purposes of this. We're keeping some of the patient confidentiality here. We're working with him on some of his behavioral issues, and certainly you know, the boredom behavior with the chewing on the door. So look, we'll chat more about that. Make sure, you know, we'll follow that up from the clinic. We can work out different things there. So guys, there are some things, we'll talk about that a bit in a minute, I think, when we get to stress. Here we go. So stress, so here's something funny. Shout out to the nation's cats who are dealing with the horrifying realization that their humans are going to be at home for the foreseeable future. I think we're missing a word there. Interrupting their naps, sitting on their sofas, and generally disrupting their daily routines of snoozes and important cat business. Absolutely, we all know about important cat business, right? Super important. And guys, look, let's get real about this. Like, so often we don't think about this because we're like, well, I have to stay home and it's my house. But hey, it's not just your house, it's a shared space. Okay. And sometimes we forget that when we're out to work from 9 to 5 or 8 till 8 or whatever crazy hours we end up doing when we're out for work, our pets own the house. And especially if you have a cat, you know, cats believe that they own the house all the time, even when there's people in it. But certainly the dogs do feel, hey, this is my place now, I can chill out. Some dogs feel that. Obviously, we've got other dogs who have separation anxiety, and they start to freak out as soon as their owner leaves the building. But for most dogs, you know, who are chilled out at home, they get used to that and they have their routine. Guys, dogs and cats are very much creatures of habit. They have routine, and they know that routine perfectly. Like, anyone who's got a cat or dog will tell you that they know how to tell the time without having a watch. You know, they can tell you when it's 5 a.m. and it's time for breakfast, or it's time to go out for a pee, or whatever it is. Like, they just know, bang, 5 o'clock, wake you up. You're like, whoa, how do you know? So the point is that they have these routines, they have these things that they do repeatedly, and that's part of their daily repertoire. And so if they're used to that, then when we come in and we affect that, we mess up their routine, we mess up their flow, that really affects how they feel, and it can cause them some stress. And so we've got to just recognize that, hey, it's cool while we're there, and you know, certainly animals help us relieve our stress. Like, you know, there's shown physiological, psychological benefits from us, well, both physiological and psychological benefits from us patting our cats and our dogs and spending time with them, and just hanging out together and being in their company. But we've got to recognize as well that at the moment, we're not the best, most fun people, stress-free people to be around, right? Like, what are we doing constantly? We're reading social media, we're getting freaked out about, you know, this development and that development, and you know, there's financial conversations, people are worried about their jobs, they're worried about our income. Like, I get that, you know, we're in the same boat. But at the end of the day, we have to be mindful that that energy that we're emitting, we might not read into it as much as you know, read into it and draw on others as much as our pets do. They are like masters at reading body language, and the smallest thing that you do, whether it's biting your nails or playing with your hair or whatever it is that you're doing, that you know, relieves stress for you, or it becomes a behavior that they perceive as an anxious behavior, they will feed on that, and they will go, mom and dad are stressed, I should be stressed, I don't want them to be stressed, and you know, it starts a whole cycle. So just be aware of our influence on them. We want to be positive, you know, influence to them, not a negative one. And guys, if you do have a pet who does get stressed, and sometimes our pets are more stressed out than us, but if you do have a pet who's that way, then there are things that you can use, and you can talk to us about it. There are things you can use, like plugins that you can use as a diffuser in the room, things like Fellaway and Adaptil. You know, there's like thunder shirts and vests and things like that you can use, wraps, to sort of swaddle them up and make them feel. Those are like more for in times of severe stress, when there's noise fears or storms and things like that. But even now, you know, those diffusers can be really good. There are medications that we can give as well, you know, and they're not all like hard drugs. We don't want to just have little like furry zombies walking around. We're not into that. But certainly, you know, sometimes we have to help with severe anxiety and stress. And so just be mindful of it, and, you know, taking care not to overstress them. Nutrition. All right. And we'll just go a bit faster now because there's just a couple more to get through, and then we'll go through a few questions. Whose cat does this? Begging for food. Absolutely, guys. So let's be mindful. I don't know, I'm sure the cat owners can relate, and probably a few dog owners as well. Like, if your pet knows that it's time for food, they will just follow you around the house, like meow, 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 like constant kind of nagging, feed me, feed me, feed me, feed me, and until we give in and we give them like a bit of our whatever sandwich, or you know, something that we're making, or an off cut, or whatever it is. And so, guys, let's just be mindful that these little critters that we love so dearly, it's really easy for them to gain weight, and we need to be careful that we're not overfeeding them, because we're going to be home. There's sometimes more than one person in the house. I don't know about you guys, but when I spend time at home, I certainly make more trips to the kitchen and end up eating more than I should. And the same can happen for our pets. We end up giving them too many treats. We end up giving them a little bit of this and that. And guys, if we actually sat down and wrote out, detailed all the things that our pet ate over the course of the day, we would be surprised, because we think, oh, they just got their food and their water, but then, someone gave them this and the other one gave them that. Oh, that's the other thing, guys. There's going to be more than one person in the house, generally. Okay. And if you've got young kids and they drop food and they sneak, their whatevers to the dog because they don't want to eat the rest of their dinner, all of those things add up. Okay. And sometimes we're doing out of sympathy and love, and we go, oh, you poor thing, here's some more treats. And sometimes we're just literally, we're trying to be helpful, and the adult kids didn't know that the parent already fed the dog, and the cat's getting fed 2-3 times a day, and they're not going to complain, they're not going to say no, but it really starts to impact them. Now, as a general rule, when we are confining pets for a period, and usually this would be post-operative, or if they've had orthopedic surgery or something like that, we would say during that time where they're not exercising as much, which is very much now, reduce their feed, reduce portion control by about 20 to 25%. So cut it down, okay? The amount of food, but also feeding them a calorie-restricted diet can help them to avoid them from gaining weight during this period of time. Now, the other thing I do need to mention, and I don't want to create hysteria or hype or anything, but look, let's be real. We don't know exactly what's going to happen with, vet clinics and pet stores and things like that being open, and whether you'll be able to get the nutrition that your pet needs. Okay, now if you have a pet who is a diabetic or has kidney failure or is on a special diet for, skin allergies because they've got food intolerance or something like that, then the diet is a critical factor and something you need to definitely have some supplies. I'm not saying to fill your whole garage full of food, because it's already full of toilet paper. What I am saying is just have enough for about a month. Have enough to get you through the next few weeks, just in case. And look, most dry foods, you can buy a bag and it's going to last in an airtight container for that time anyway. So it's not about going crazy and filling the house up, but have enough of that food so you don't need to change. Now, being mindful that if there is a change, generally that will upset your pet's stomach, especially if it's a sudden change. So when you are changing diet, that should be over a period of about 5 days, and you gradually mix in the new diet with the old diet until they've transitioned. Now, I don't want you to transition. I want you to actually have enough of their normal diet, because again, any disruption there is going to cause stress for them, maybe gastro issues, and then if the vets are shut, you're not going to be able to get any help with that, and that's something that could be a bit of a nightmare, especially if you're trapped in the house with a cat or a dog that has diarrhea. Okay, let's keep moving. Prevention. Let's prevent them from the nasties. What are the nasties? Okay, so guys, the 4 most common things that we talk about: fleas, ticks, intestinal worms, and heartworm. Now, the last thing we would want, again, when you're trapped in the house for a period of time, is to have a pet that is just constantly scratching and all those fleas that are jumping off them and infesting your carpet. Because I don't know if you guys know, but an adult female flea, lays up to 50 eggs a day. Okay, and worms, I don't know the exact number here, but literally they can just produce hundreds and hundreds of eggs continuously. And so again, you won't see worms. They'll be attached to your dog or cat's intestines, and they'll be shedding eggs and cysts through their poo, or various other places they might rub their bum, and fleas. You just don't want them in your house, okay? It's going to be a real nightmare, and you won't be able to get pest control to come out and spray the carpet. So guys, just don't do it. Moral of the story is, if your pet is overdue from fleas, ticks, heartworm, or intestinal worms, and guys, a lot of people mix up heartworm with intestinal worms. Heartworm is spread by mosquitoes, okay? And intestinal worms, they pick up from their environment. They pick up from mum, they pick up from other dogs, they pick up from sniffing each other, you know, all sorts of things. But ultimately, ticks, ultimately, you know, whatever it is, heartworm or intestinal worm. In fact, some of the intestinal worms can pass on to humans. And so we do want to be really careful that we don't allow them to develop numbers that are going to shed and cause infestation. So here's a really simple, easy thing. If they're not covered for those 4 nasties, cover them. Okay, it's going to be either a spot on or a tablet, or, you know, well, those are your main ones. Obviously, heartworm is spread, you know, is spread by mosquitoes, and that's something we protect with an injection, the once-a-year injection, and that's the best thing really to use for them, to give them the maximum length of protection. Because, guys, hey, let's be real. As humans, we forget, and you know, there's been a heartworm surge in numbers, and when they looked at the number of animals and they tested them, and the ones that were heartworm positive, there was a large percentage, I can't remember the study offhand, but there was a large number of them that were already on a monthly preventative tablet. And it's not that the tablets are no good, they were actually really good tablets that they were on. And in fact, a lot of them were actually veterinary professionals themselves, and nurses and vets, dogs that were tested. But they found these were heartworm positive cases because the owners had been forgetful. And we do that. Life gets in the way, you forget a dose. So if you've forgotten a dose, no shame, no guilt, get what you need and get it up to date, because most of those things will last for at least 1 month or 3 months, or like I said, with the heartworm, last for a year. So that's going to get you through this little patch. Cool. Prevention, medication. Okay, again, don't forget that they need it too. Again, if you have a patient who is epileptic or has skin allergies or arthritis or something like that, where they need medication on a daily or twice daily basis, then that's something. Maybe they're incontinent, maybe they need something once a week to help them from not wetting the bed. You know, all of these things, can turn into big issues if we're not on top of it. So someone was just asking a question there about medication. Is there a supply issue? Okay, so look, at this stage, with both food and medication, there is no supply chain issue. There seems like there's more than enough. Like in terms of suppliers, like we would generally use multiple suppliers. We have like one main supplier, but then there's multiple other suppliers that we can call on if we need to. So usually getting stock in, and most clinics will order 1 or 2 times a week, once or twice a week. And so as long as you can get in there, you can have your things delivered, ordered in. And if you're stuck at home and you can't get that medication, then we can certainly have that brought to you. We can drop that off to you. That's certainly what we've done for a few of our clients, and we just sort of leave it at your letterbox or something like that, and you can collect it. Medication, that's what I would recommend. Stocking up, again, not like a year's supply. We just need enough for a month or so. And make sure they're healthy. Like if they're due for a recheck or they needed blood testing before they can have a repeat script, just get that done, guys. The last thing you want to do is end up with a sick animal at home when you're stuck and all the vets are shut and there's nothing that you can do. So stock up on medication that they need. If you feel that there's something that you've been holding out on, you think, oh, they're looking like they're getting stiff, or the dog might benefit from some anti-inflammatories, etc., then talk to us about that. Let us have that conversation and prepare before that time. What else will I say? Right, veterinary care. Okay, so guys, chat to your vets. As I said, and I know that there were a few concerns about our vets, as someone posted before, our vets going to be seen as essential services. Now, as far as we know at this point, yes, the authorities seem to acknowledge that we are an essential service, and they've kept us open. But I know in the US, for example, GP vets have been shut, and only emergency vets have stayed open. Okay, and look, different countries are doing different things there, and so I really can't comment too much on that, other than in terms of what the future holds. But certainly a lot of us are gearing up, and we have the facility to offer something called telemedicine, telehealth, where we can converse with you and have a consultation as such over the phone, or via voice, video conference rather, or audio. But ultimately, guys, what these are really is, it's a lot of it is more of a service to find out what's going on and determine whether they're serious enough that they need to come in or not. Okay. Unfortunately, a lot of core services like, sample collections, taking a blood sample, or, palpating an abdomen, or looking down an ear canal and taking a swab from there. Those are things where we would need to have the live patient so we can really see what's going on. But as much as possible, guys, if you are going to your vets, make sure you're just following the required restrictions. So, if you have traveled, obviously, or if you've been in contact with somebody who's ill, etc., or COVID positive rather, then you're taking necessary precaution not to take that with you to the vet clinic and infect all of them rather. What we want to do is, a lot of vet clinics are practicing very stringent barrier methods where we're doing car park consultations, and people are being seen in the car park. Animals are being collected, brought into the clinic, or the doors are being shut basically, and clients, pet owners can bring their pet to the door, and we will get the history, get the relevant information from them at the door, and then bring that pet into the clinic, assess them, give them the treatment, take the test, whatever it is that they need, and then bring them back to the pet owners and discuss their needs there. So that's happening currently in a lot of vet clinics. There's a lot of, red tape and black and yellow tapes everywhere defining where people can and can't stand, and essentially limiting people, sometimes, one person in a waiting room at a time. So just a lot of social distancing at this point. And obviously there's a lot of face masks and hand sanitizers with alcohol being placed around. But guys, just a quick reminder, alcohol would have to have alcohol in them, and I believe it's got to be over 60%. But the other thing that's really important is to wash your hands. Okay, and like vets are used to scrubbing a lot because we do a lot of scrubbing for surgery, and you've got to scrub for a decent amount of time. So I know they talk about a good hand wash being at least 20 to 30 seconds with soap contact. If we're doing a surgical scrub, guys, that's at least 3 minutes, 3 to 5 minutes that we will be scrubbing there with a little brush. So what's important, again, is exercising those precautions when you're going to your vet, and trying to be as clean and sterile as possible when going into those environments, and avoid them if necessary. But don't neglect your pets in the process. Certainly, exploit these facilities that are now available through telemedicine. Contact your vet clinic, see what they can do about it. It's certainly something that we offer. And, if whatever we can do to help in terms of visiting, if you're in isolation as well and you physically can't get to the vet, we can come out and collect from you, and meeting people, not meeting them, but meeting their pet in the garden, and then bringing them in. That's not an issue at all. And guys, look, so many vets right now, we genuinely are so worried about the pets that are out there, and their pet owners obviously as well. But our hearts go out to the pets first, unfortunately, or fortunately, as it may be. And we're going to do absolutely everything in our power to make sure that we give them the treatment that they need and the care that they need, so there's no suffering. All right. We've spoken about this a little bit as well. Measures taken at vet clinics to reduce the spread. Guys, hygiene expert, I just want to mention this. A lot of people don't realize, but vets deal with contagious viral diseases on a daily basis. Okay, things like parvovirus, kennel cough, ringworm. It's not a virus, but it's a fungus. But we're used to taking really stringent hygiene measures. Cat flu is another one where we're used to stopping people from coming in and avoiding contagious situations and disinfecting areas and leaving them for 20 minutes or half an hour for that room, and spraying us. Sometimes we walk out of a consult room and we grab a spray bottle and we spray ourselves with the stuff and spray our stethoscopes and everything else. So vets are used to doing this stuff. We've been doing it for years, and we're in a really good position to ensure and maintain really stringent hygiene when it comes to COVID and stopping the spread of corona. So most vets are going to be really good at this. You don't need to worry about that. Social isolation, we've spoken about that. Social distancing, doing as much as we can in the car park versus in clinic. And if people are coming into the clinic, pet owners, then that's being limited to one per person. Sorry, one at a time in the waiting room. Telephone video triage, so that we only see the essential cases, only the emergencies for the cases, collection from home, medication drop-off, telehealth. We've spoken about all of these things, and having your preventatives posted. So this is something as well which is emerging, and it's a really cool thing if you can have your preventatives posted to you. It's certainly something that we now have available, is to be able to deliver people's, not deliver them ourselves, but have them posted. So usually people will get a text message saying when things are due, and then you would have to go to the vet clinic and collect the medication and then give it to your pet. But now there's some pretty cool services where you can actually have those preventatives delivered to your door. So when that tablet is due, you get that tablet as a single tablet and you just give it, rather than buying a box of 6 or whatever and then forgetting where you put it, and you get this text message and you end up buying another box and all sorts of stuff. So ultimately, having that service there means you don't have to come to the vet clinic every month or 3 months in order to get that. I'm not saying we don't like to see you, but obviously at this time where we're exercising precaution and we're limiting access to vet clinics, and that is the way to go. Alternatives to vet visits and what to do if you're in isolation. Guys, friends and family, use them. That's what they're there for. If they can help to collect your pets and bring them into the vets, that would be amazing. A lot of vets are really, really busy right now. In fact, there's sort of two camps. Like, some are really quiet because everyone's just staying away, and others are really, really busy because everyone's like, oh my goodness, it's all going to shut down. Let's get everything treated. And the other thing as well, even if people aren't panicking, they're just at home more. They're seeing their pets. They might not be sick, but they're at home because work's closed down or whatever, and they've got time, and their pet needed their vaccines or needed their whatever, looked at that lump, and so they're finally getting it done. And look, we encourage that because we know everyone's busy, and it's really hard to get a lot of things done when you have a busy work schedule. And so certainly bring them in. It's not an issue if you do need to bring them in. And let's be real, guys. Like, sometimes we think, oh, vaccine, is that an essential or not essential? Is that an urgent thing? Guys, a lot of our pets, unfortunately, only get seen once a year when they do go in for the vaccination. And it's quite often, like, as a vet, when we see that pet once a year, that's when we will pick up on the arthritis or a lump in their abdomen that we can palpate, or a little nodule on the skin, and we're like, oh, this one needs to be tested, and this one needs to be removed. So those things, unfortunately, I had a dog the other day who was in for a vaccine, and one of the ears was like really, really festy, and lovely, sweet owner, but she didn't notice that. And when we took a swab of the ear and looked under the microscope, there was a nasty infection going on. So those things do need to be seen, and they need to be seen regularly. You should take your pet to the vet more than once a year. I know most people are only vaccinating once a year. I'm not suggesting that you vaccinate more than once a year, but get your pet checked out more than once a year routinely. And also, we'll talk about this maybe a bit later, but get educated. There it is. So educating yourself as a pet parent, becoming a proactive pet parent, knowing what you need to know as to how do you check your dog on a regular basis. It's a bit like doing a little maintenance on your car. Do you know how to check the tire pressure, walk around, do you know how to change the oil and water if you needed to? Just some basic things. Can you fill your own fuel tank, not put the wrong fuel in the car, that sort of thing. Like, every pet owner should know that. As part of being a responsible pet parent, we really should take at least that level of interest to learn those things so that we can stay on top of that. So get educated, and we will be releasing some really cool courses. I know a lot of people have time. They're sitting at home right now, and they're like, hey, now's a good time to learn. And so, we actually have a lot of cool things that you can learn and do for your pets, and ways that we can teach you how to better care for them at home. And look, it's ultimately going to reduce your vet visits, even if there's no coronavirus, and you're going to save a lot of money. by getting in really early and picking up on those things and managing that yourself. I'm not saying to jump on you. Please don't do this. I'm not saying jump on YouTube and learn all. I gotta be careful what I say, but there's some wacky things out there, and some of the home remedies out there. I just do not recommend them at all, and so I'm not suggesting that as a way to avoid going to the vet, but I am suggesting being aware of early stages of certain conditions and knowing what things you need to worry about and what things you don't. The unfortunate truth is that a lot of people bring their pet to the vet and they're oblivious and unaware of what's going on, what their pet's eating, how long that lump has been there for, how long that rash has been going on for, or how long that discharge has been coming out of the ear. All these things are really important questions, or how long that tooth has been cracked for, and how long has your pet been chewing on the left side of their mouth because the right side has all this disease and infection. So these are really important things, and they do hurt us a lot actually as a vet when we see pets suffering like that and owners who don't know what's going on. So I'm going to get off my soapbox, but ultimately learn more about these things. So again, we can work together, the three of us, to create a healthy, happy pet. Pet collection from your home, we've spoken about. Preparing your pet for the trip, giving them a bath. Guys, look, there's no obvious there's been no confirmed evidence, rather, that's the word I'm looking for, no confirmed evidence to show that pets do carry coronavirus on their fur. And I know that was actually one of the questions that somebody emailed through earlier before the session. They said, I really want to know, what about the droplets, from our saliva, from coughing, sneezing, etc. on my pet's fur? Is that not a risk? And so, look, generally, from my understanding, is that the virus lasts for a much longer time on hard surfaces and does not last very well on softer surfaces like fabric and fur and things like that, which is why clothing, is also not such an issue. However, having said that, if you are corona positive or somebody else is and their pet needs to be seen by a vet, then the recommendation is to at least give them a bath in warm soapy water to get a lot of those things off the fur, so that when they are seen to by the veterinary team, then they would probably be wearing masks, etc. And obviously letting them know that this pet has been exposed to someone who's corona positive. It doesn't mean that pet can't get treatment, that pet can still be treated. We just need to exercise more precaution around that. Close monitoring of your pets, we've spoken about that before, knowing what to look for, knowing how to brush their teeth and do all those things, do lump checks, etc. Being very hands-on with your pet. This is super important, guys. Okay, so why some pets are suffering during this pandemic? Misinformation and hysteria. Unfortunately, we've just got to make sure that we're double checking, triple checking the source of information. If you have any specific questions, guys, we are just continuously reading about COVID-19 and staying on top of this, and we're in touch with all of the health organizations, the Australian Veterinary Association and the international veterinary associations as well, and staying abreast of what's going on there. So if you have questions about the stuff, just get in touch with your vets and they can help you to work out what you need to do. Poor home care, obviously, I just wrote their cultural values, like different, and I don't mean to be discriminatory here, but ultimately, like even cultures within one ethnicity, like some people will have pets as part of, what are the values? Is your pet like a child? Are they in the house? Are they sleeping on your bed and next to you, for 8 hours of the day at your feet, so you see and hear everything they do? Or are they very much in the garden doing their own thing? They only come in for a feed, or you don't even know if they've eaten because you fill the bowl up outside and they kind of do their own thing. Now, that's all the point I'm trying to make here is sometimes those animals who are not as connected with their owners, or their owners don't know what's going on, it's very easy for them to have these diseases which persist for a long time, like ear infections or whatever. They've been drinking more and nobody's noticed it because they've got kidney failure or diabetes or something, and we didn't pick up on those signs because no one ever measures how much the dog drinks from the bowl. Things like that can be left a long time. And so, at this point, I suppose the more we can interact and be observant of what our pets are doing, the more we can provide them with that care. Compromised humans, the elderly, etc. Not much to say here. Obviously, if they're in isolation and they're unable to be seen, then that's what's going on, and their pets unfortunately aren't going to get the care that they need. So guys, just being mindful of the time. Oops, sorry, this is a repeat slide. Yes, questions, great. Well, I mean, that's the end of the presentation, the formal presentation. I know there's been a few questions along the way, which I've sort of answered through the points that I've discussed there. But there's a question coming through. What about specialist services? Can my cat still have his ultrasound? Yes, yes. So thanks for that message there. So we do have visiting specialists who come to the clinic to perform ultrasounds, or we have a cardiologist who comes in and does echocardiograms of the hearts and consultations, and also surgeons who come in and perform procedures there, orthopedic surgery, etc. All of those things are still happening currently. I don't know what will happen in the future, but for now, absolutely, we had a surgery today with a orthopedic surgery. So, those things are still very much happening at this point. Yes. And those are the sorts of tests, those are the things where we can't do by telemedicine. We can't do an ultrasound by teleconference, but we can certainly give advice, or we can probably do a bit of a workup to the point where we decide, yeah, you know what, your pet probably needs an ultrasound or they need an x-ray, and that would be the point that you bring them in. So good question. Thank you. So somebody else here is asking, oh, okay, again, the supply chain. So we addressed it. There's no known shortages at this point on food or medication, but certainly having a bit of a supply at home just to get you through would be sensible at this point. Somebody else is asking about arthritis medication for old dogs. Yeah, look, guys, and it's winter. Winter's coming in. It's not winter yet. It's still quite hot. My window's open, the fan's going. But ultimately, it's getting colder. And those seniors, guys, these are the biggest concern that we have is the senior pets out there that are not going to get the adequate care that they need, because these guys are the ones who are starting to show signs of disease. Okay, if you've got a pet who is, 7 years old, i.e. 56, 50 years old, or above, then they are classed as a senior, and they've got 50-year-old body parts and, joints and organs, and those start to fail and they start to need help. And some of that is just medication. Some of it is just supplements or changes of diet that they need, and others need medication to keep them comfortable. So look, this is a big thing. Arthritis, I know a lot of our senior patients are on a monthly arthritis injection, and you can get them topped up, and hopefully that'll then carry them through for a month. But a lot of the time they will need more than just the arthritis injection. They will need anti-inflammatories to help them. Those arthritis injections are amazing, and they certainly help. What they do, basically, for those of you who don't know, is they stimulate the body to produce synovial fluid, which is the grease in the joint, and they also help to produce cartilage formation, which basically helps to coat the end of the bone. So it's not like a grinding bone on bone in a dry joint, but we've got a nicely oiled, lubricated joint that has a shiny surface of cartilage rubbing on shiny cartilage, and so there's less friction. Sorry, I'm sidetracking here, but ultimately what I'm saying is arthritis, especially now coming into winter, if you have a pet who's a little bit stiff or creaky, then those injections and the supplements, the oral stuff, might not be enough. You might need to contact your vet and get some anti-inflammatories, get some medication on board, and they might need blood testing beforehand if they haven't had a blood test recently to check that their kidneys, liver, etc. are all okay, so that they can take that medication. So yeah, stock up on those things. I think that's probably the last of the questions. Oh, good, this came up, and I don't know if it came up at all in the discussion, but someone asked here, can I catch COVID from my pet? Let's just deal with that. No, at this stage, no, you cannot catch COVID from your pet, and your pet cannot catch COVID in a harmful form from you. I know there were reports of the dogs having COVID in their airways and in their mucosal surfaces, and COVID was cultured from there. But that COVID could have been cultured in the environment as well, could have been on the table, in the bedding, and everywhere else. That doesn't mean that those animals were infected with COVID or that they died. There's no proof that any animals have died from coronavirus. There's a different type of coronavirus that affects pets, but that is something that we can treat for, or that we can vaccinate them against. And this has got nothing, well, it's nothing to do with corona, but it's a completely different strain, and it's got nothing to do with COVID-19, the one that is causing this, worldwide pandemic, and the one that is affecting everybody. So your pets are not a threat to you, and you are not a threat to your pet, and therefore you should love them and hold them and spend time with them and be close to them. But be mindful of them getting into contact with people who are COVID positive, just in case those droplets do spread through the pet to you. Again, there's no proof of that just yet, but we're exercising precaution there. And hopefully, you're not in an environment with a COVID positive person, or you don't have COVID positive, not COVID positive yourself. But if you are, hey, no judgment, guys. As I don't mean this to sound negative or anything, but ultimately just take extra precaution, okay, that your pet shouldn't contract anything from you. So guys, it is getting a bit late, and I thank you all for your attention. I know there might be some more questions that have come up along the way, and if they are, please feel free to email them through, contact the clinics, you can email myself, send them through, and we hope to have more sessions like this in future. Guys, again, this is all about education and awareness, and hopefully tonight has been adequate to give people what they need to go out and educate a few more people, help a few more pet parents, and save a few more lives. That's our ultimate goal from doing this session tonight. And the other thing I was going to say is we are looking at having more sessions, and obviously as things update and with this new information to pass on, we will be bringing that through as well. So please, for future events, just register. There are limited places, as you've seen tonight. We've got a fairly big crowd here tonight, and so thank you guys. You've just been an amazing group of people. It's really, I just want to say the very last thing is, it's just so comforting and nice to know that there are dedicated pet parents and pet owners who don't like to be referred to as pet parents, but they're equally as caring, and they look after their pets, and they're doing the right thing. And those pets are going to live long, happy, healthy lives because they've got caring parents who are responsible and proactive and doing as much as they can to look after their pets. So I really just want to say thank you to all of you who have taken the time to come here tonight. Honestly, it's really touching, and it makes us, it makes it all worthwhile, and it reminds us why we do this, and why we've taken this path, and why we've got the scars on our hands and all of this stuff, because it's so worth it, because of you guys and your pets. So thank you so much again for being here. And I hope you guys all stay safe and look after yourselves. And please reach out to us if there's absolutely anything you need. Take care.